This is Global Health, and I'm Gail Fraser. This is Unit 12, Part 2, and we're going to be discussing our case studies now. So let's start off with talking about Guyana. Of course, you know that here is Colombia, and Guyana is just right here next to Venezuela. So it shares a border. Actually, they have regular disagreements about exactly where that border is with Venezuela, and then, of course, with Brazil. And I think that Guyana, like many countries that have very high rates of HIV positive individuals, they blame it on the Brazilian sex workers who come across the border. It's kind of like people in Indonesia, which is a predominantly Muslim country, blaming HIV problems on the Thai fishermen who come down from Thailand. It's just very unrealistic. They've got their blinders on to pretend that they don't have a problem and that they are not responsible for taking care of the HIV prevention and different strategies that have been found to work well in other parts of the world. Colombia does not have a big HIV problem. I guess the preventive strategies that they've implemented in a lot of the Latin American countries, the Spanish-speaking countries, have been very successful. So Guyana is just a carryover, a former British and Dutch colony. It is one of the high prevalence areas in Latin America. So Guyana is the highest HIV prevalence rate in the whole region. Out of a population of less than 1 million, there have almost 20,000 people in Guyana that have HIV. In 2008, so these statistics are probably have changed some, and unfortunately probably have gone up. So 1.5% of the pregnant women who are screened just through routine screens are HIV positive. 15% of young men and women clients with sexually transmitted infections. So if they come in for gonorrhea, there's a good chance that they would also be HIV positive. 22% among patients with tuberculosis, because as I mentioned, when you have HIV, you have lower resistance to many infections, and even certain types of cancers are more likely to occur in people with HIV. So they're more susceptible to tuberculosis. 27% among female sex workers. So you've got men and women who are commercial, meaning they receive money for sex work. And so 30%. Now that is huge. That is very high for any place in the world. In contrast, we've got Mozambique. So Mozambique, here's the northern part of Africa. So that's Algeria, Libya, Egypt, Sudan, Chad, Niger, Mali. These countries are more Arab than and most of the people there have different cultures and they're predominantly Muslim. Whereas when you go into the sub-Saharan, so the Saharan desert goes right across the top here. As soon as you go into Burkina Faso, Nigeria, Central Republic of Congo, all of sub-Saharan Africa, they have a serious problem. So Mozambique is in the western, the eastern portion of Africa. It's more allied to the southern portion. When you think of East Africa, you usually think of Kenya, Tanzania, Rwanda, Uganda. This is considered part of East Africa. The Horn of Africa is Sudan, Ethiopia, Eritrea, and Djibouti. So this area here, so they called it the Horn of Africa. Southern Africa tends to be these countries here. So Zimbabwe, Botswana, Namibia, South Africa, Lesotho, Swaziland, and sometimes Mozambique is included in the southern part of Africa because it's a long, slender country. So you can see that it's quite a big country, and it's actually very mountainous. And this is one of the reasons that Mozambique is a difficult area to work in for any type of infectious disease prevention, but especially for HIV, because you've got a lot of remote areas that are difficult to access, and it makes the fact that they have fewer health clinics and ways that they can receive information about HIV prevention. Mozambique has a population of 20 million, so quite a bit bigger than Guyana, and it is one of the highest poverty rates, so it's a very, very poor country. It's a former Portuguese colony, so they still speak Portuguese there, and it became independent in 1975, and then it had a decade-long civil war, so it lost a lot of resources at that time. The per capita income averages less than $300 per year, and that's one of the lowest in all of Africa. The high prevalence of HIV infections includes tuberculosis, malaria, and combined poor health care limits life expectancy. So again, the average life expectancy in Mozambique is only 47. That's really low, because most of the countries we were looking at, 70, 67, 80, 47 is, you're a young, middle-aged person. An estimated 1.6 million people are HIV infected, and that has a seroprevalence rate, just normal population, of 16%. So it's less than the 20% that we were finding in Guyana, but still very high. The healthcare system, primary healthcare services, are generally delivered at the clinics that may not be open every day. So Tuesday and Thursday, they have a nurse there. The health system suffers from significant human resource shortages. So that means that, again, with life expectancy being so short, the young adults who are qualified as nurses or physicians, there are just too few of them. 700 doctors for the whole country, 4,000 nurses. So it's not high per person because it has a fairly populous. The health centers, they have rural hospitals, provincial hospitals, but again, the main centers are in Maputo, which is the capital, and you may see the capital here. Where is it? It's not mentioning it, but it's quite far south. So you've got all this northern portion that basically has limited services. Again, we want to emphasize the successful use of wellness centers, and it might be something they've just set up. They use a lot of these shipment cargo containers. And yes, they can be very hot, and so adequate ventilation is necessary. So there are some limitations of using these metal boxes, but again, if they can get them donated, it's almost a free platform for safely being able to store tables and chairs and different types of equipment for these wellness centers. And so they are popular for use to recycle these shipment containers. HIV care and support lasts a lifetime. So it's like a chronic condition that you have to receive treatment for the rest of your life. Routine monthly and quarterly visits are necessary. Wellness centers offer counseling and a variety of health promotion and nutrition information. So again, it's a very positive way to have this continuous treatment. You join a community of people who are not threatening you. You don't experience stigma. It's a very positive experience. In South Africa, so again, here's our map. Sub-Saharan South Africa is right here on the tip, and if you've ever visited there, it is the most beautiful place in Africa in my mind. It looks a lot like California. I grew up in Orange, California, and it's got these wide open grassy fields and a beautiful jagged coastline. And of course, you've got your great whites and all those different people, the dangerous fish that migrate through this area because of the location. And so but it has beautiful beaches, and you go surfing, and they have no shark nets. So you have to be very, very careful when you're diving or surfboarding or using the beach, because the great whites do migrate in through this area, and a lot of deaths do occur every year. South Africa has a population of almost 50 million, so the density of population is far greater than in Mozambique. The terrain is much more like hills, and it's suitable for agriculture, and it has great wine growing areas. It's famous for many things, including its game parks. It has an abundant supply of natural resources, particularly diamonds. It's well-developed infrastructure, fabulous highways. One of the problems is because they have such good roads is that people drive too fast, and accidents tend to be fatal accidents when they do have wrecks on the highway. Outside the country's 4 major cities, there's a vast majority of South Africans are very poor. So you've got that bipolar. You've got the very rich in the big cities, but then people who live in the rural areas are impoverished. 1/3 of the population lives on less than $2 a day. So those are pretty poor. South Africa has an estimated 5.5 million people living with HIV. That means that they have survived. 300,000 people living that are actually on antiretroviral treatment. And that is very, very costly treatment, especially if they discontinue treatment and come back when they're feeling much more ill. They have to reinitiate treatment with different types of drugs that are a lot more expensive. So it's quite a complicated lifelong treatment plan. And we want to have people be maintained on treatment so they're what they would call adherent to their treatment, continuously taking their treatment. And then if resistance for those drugs develop, then they can put in what they have as a second or third line drug or combinations of drugs. So Republic of South Africa, or RSA, is seroprevalence is about 19%. So here we come back down to 19. The HIV has orphaned about 1.2 million children. So again, it's a huge public health problem to have these children being unaccompanied by parents that are caring for them. HIV is most strongly affected in women. So 1/3 of pregnant women, when they're screened routinely, are HIV positive. So that's 33%. Females of younger age are 4 times more likely to be infected than males. Here's my team, and you can see here I am smiling with my shorter hair among my different colleagues that were from Tanzania, most of them. We had some of the researchers. I think you can see the boss who's from these 2 people, Wafa and David. They both came over from Columbia University in New York City to just see how we're doing. But this is the team that I work with, and routinely went on field visits with at least 4 or 5 other national physicians and nurses that traveled with me to go to the different clinics. We were responsible for 30 different sites in northern and eastern Tanzania, and 10 Kenya, Uganda, and Rwanda. And also, well, one of the nice things is we had 3 clinical sites that we visited in Zanzibar. So that's a beautiful place to visit, and it's part of Tanzania. So South Africa, the Columbia University in New York City has the International Center for AIDS Care and Treatment Programs, and it support prevention of mother-to-child transmission, which is PMTCT, and life-saving antiretroviral treatment. We're combating an enemy within, and so you can see the bars will not protect you from AIDS. So these are different types of promotions that make people aware of HIV. So in summary, health disparities due to HIV are linked to human rights, and positive communication is the most successful thing that you can do globally, because if people can be identified as HIV positive and receive the treatment that they need, they can actually live a longer and more productive life. And it needs to be put in a positive sense. They've found that this is a much more effective way, because I know that for HIV care and treatment, I worked in South Africa, I worked in Mozambique,